A Behavioral Conceptualization of Suicide and Suicide Prevention by Taylor Avis and Dr. Jonathan Ivey. Suicide is something that most people are somewhat familiar with. A 2020 study from the New England Journal of Medicine found that 800,000 people die by suicide globally every year. Additionally, suicide is the 10th leading cause of death in North America and the leading cause of death worldwide amongst adults ages 15 to 24. Suicide rates in the U.S. have climbed 1.5% per year since 2000, showing that the problem is only getting worse rather than getting better. Applied behavior analysis, also known as ABA, identifies environmental variables and their influence on behavior while applying behavioral principles to produce socially meaningful behavior change. Many precursors to suicide are behaviors such as withdrawal from activities, drug use, self-harm, suicide attempts, etc. Despite this, very little behavior analytic research has been done to address this situation. The objectives of the current study are to examine some of the existing approaches to suicide and suicide prevention, examine those approaches through a behavior analytic lens, as well as discuss potential behavior analytic solutions and areas for future research for behavior analysts. Some current approaches. Cognitive behavior therapy, also known as CBT, is one of the foremost interventions for addressing suicidal tendencies. CBT focuses on redirecting thought patterns and replacing negative thoughts with positive ones. Dialectical behavior therapy, also known as DBT, is a branch of CBT that focuses on teaching emotional regulation, which is believed to help with harmful behaviors. DBT was initially developed to combat suicidal behaviors, making this a key part of the intervention. Acceptance and commitment therapy, also known as ACT therapy, is based in ABA, and it assumes that behaviors serve particular functions in one's environment. Now we are going to discuss some of the behavioral accounts and approaches to suicide from the previously mentioned interventions. CBT focuses on thoughts causing behavior, whereas ABA believes that thoughts are behavior, known as private events. The rationale behind CBT is that by reducing or redirecting negative thoughts, this leads to a decrease in the likelihood of suicidal ideation and behaviors, which in turn decreases the likelihood of suicide. Conversely, ABA focuses on environmental variables to change behavior rather than unobservable thoughts. DBT relies on behavioral chain analyses to examine the relevant precursors and consequences to behavior, which is somewhat similar to functional behavior assessments seen in ABA. DBT also uses behavioral skills training and exposure-based strategies, which are sometimes seen in ABA interventions as well. DBT conceptualizes suicidal behaviors as maladaptive problem solving, where the goal is to solve unbearable emotional distress. ACT therapy conceptualizes suicidal behaviors as a learned method of problem solving to escape or avoid intense negative emotions and stimuli. Experience avoidance is key to ACT therapy and is the concept that suicidal behaviors serve to provide escape or avoidance of aversive events, also known as negative reinforcement. The goal of ACT therapy is to teach individuals how to respond to unpleasant events appropriately. Current gaps in the literature. Despite increases in research on interventions addressing self-injurious thoughts and behaviors, also known as SITBs, there are currently no well-established treatments for suicidal or non-suicidal SITBs in youth. Effect sizes tend to be smaller for studies that involve children or adolescents, and they tend to be larger for studies that involve adult populations. Intervention effects have not improved over time despite exponential increases in randomized controlled studies examining SITBs. Additionally, we largely attribute suicide and suicidal tendencies to mental illness, despite the fact that only 54% of people who committed suicide had no known mental illnesses. There have been increases in suicide rates despite increased intervention and awareness. ABA could help. A study examining a VR simulation of suicidal tendencies found that small shifts in the anticipated probability of rewarding versus punishing consequences of engaging in VR suicide cause significant decrease in VR suicide rates. Additionally, a meta-analysis found that most approaches to suicide are theoretical, and they argue that targeted, experimentally informed assessments to determine specific causes of SITBs might be helpful. This is similar to ABA's functional analyses, which experimentally determine environmental variables maintaining behavior. Additionally, many precursors to suicide are behavioral, such as substance abuse, social withdrawal, self-harm, etc. Despite this, very little behavior analytic research has been done to combat this issue. Behavior analysts may provide a new set of expertise and solutions through ABA and should consider exploring this area further.